Hi guys, my name is Cami. I am going to teach you today about dexmethylphenidate. It's also known as Focalin. This drug is given in combination or given with other drugs for people with ADHD. People who have ADHD have a weakened physiological activity going on. So what this drug is going to do is stimulate the central nervous system and the respiratory system to increase the attention span in these people. It's typically given as a tablet. With children, it is prescribed at 2.5 milligrams taken twice a day, and it can be increased to 10 milligrams twice a day if it's needed. For adults, if they've never taken Focalin before, it's started out at 10 milligrams once a day, and it can be worked up to 40 milligrams a day as just a single dose. So what you need to know before administering this medication, you want to give them the medication in the morning for their first dose. And you want to encourage them to swallow the capsules whole, but if they can't do that, then it's okay to open them and sprinkle just a little bit on some applesauce. You don't want a whole lot of applesauce, you just want a small serving because it's really important to make sure that they eat it immediately. You don't want it sitting around, and you want to make sure they're eating all of it, the entire serving of applesauce that you give them, to make sure they're getting their complete dose. So you want to make sure you're checking the blood pressure and the pulse and respirations before you give this, and you want to keep checking them throughout the treatment. You need to make sure you're getting a physical exam done on them to check for any issues that might prevent you from giving them Focalin. You also want to make sure you're weighing them before treatment so that you have a baseline, and you want to be weighing them every 2 weeks after that. You want to get a baseline complete blood cell count and platelet count. Those ones are going to be the most important lab works to make sure you have. So just like any other medication, Focalin is going to cause adverse effects. It might be a change in behavior, and if these lead to thoughts of suicide or self-harm, it's really important to tell the provider about that. It may also cause hallucinations, insomnia, excitement, nervousness, and thought disorders. It can cause visual disturbances, so make sure you're warning your patients about that. You want to make sure you tell them it may cause abdominal pain, loss of appetite, and nausea. So if you do notice a loss of appetite or your patient's losing weight, it's really important to make sure they are getting enough nutrition. So when they actually are hungry, give them as much calories as possible, as much as they can tolerate pretty much, whether it's just adding gravy to smaller servings or giving them a little bit bigger servings if they eat it all. So you also want to tell them it can suppress growth. And again, that goes along with the weight loss, especially in long-term treatment. So again, just let the doctor know if there's any changes in behavior, and you want to make sure you're monitoring those vitals closely and alerting the provider of anything that's alarming, and make sure you're getting that blood work done periodically as well. Give Focalin as prescribed. Make sure your patient's taking it as prescribed. It's really important to have that therapeutic level. You want to make sure it's not too much or too little. So that's pretty much the most important parts of Focalin. If you guys have any questions, just let me know, and I will do my best to get back to you. Thanks.